Good evening, doctors and all participants. We are here again. Hope you all guys are all right. Again, let me introduce myself. I am Dr. Rizin Kusop, the Secretary of APS. Welcome to our free live streaming webinar brought to you by the Association of Private Practitioners Sabah, APS. During the session, we will have a question. If you have question, please write them down at the comment section in the YouTube platform so that they can be addressed by the speaker at the end of the session. Our speaker this evening is Dr. Andi Rahardja, all the way from Kuching, Sarawak. Dr. Andi Rahardja is the pediatrician, graduated in Master of Medicine Pediatric from University Science Malaysia. He has initially worked in Indonesia and subsequently various other hospitals in Malaysia, and has been involved in various academic fields related to his specialties. Dr. Andi Rahardja is now the consultant pediatrician in Borneo Medical Center, Kuching, Sarawak. The topic he will be delivering today is dietary intervention in at-risk of allergy children. Sound very interesting topic. Ladies and gentlemen, all the way from Borneo Medical Center, Kuching, Sarawak, Dr. Andi Rahardja.
Thank you very much, Dr. Rizin, for the kind introduction. Good evening, all my colleagues, on this Sunday evening. So today talk is about allergy. So the incidence of allergic diseases in children appears to have significantly increased over the last decade. So since environmental factors, including diet, have been thought to play a significant role in the development of this disease. So there is a great interest in identifying prevention strategies related to the early nutritional intervention. So today's talk is about what is allergy, and then we talk about the risk factor, prevalence, allergic marks, and dietary strategies, including breast milk substitute for the non-breastfed children, and we talk about Malaysian allergy prevention guideline. Okay, first, what is allergy? Allergy are inappropriate immune responses. So this harmless substance usually doesn't cause anything, but in allergy there is a inappropriate and excessive immune reaction. So the immune system mistakenly identify a harmless substance as a threat and then initiate a violent reaction that triggers allergic symptoms. And once the immune system has been sensitized to an allergen, the immune system retains the memory of the allergen and will recognize it again. A new contact with this allergen will lead to allergic reaction. Okay, so how does this happen? So for allergy to exist, the allergy sensitization must first occur. The antigen presenting cells such as macrophages and the dendritic cells that are present in the mucosal surface detect this allergen, and then this can occur in many ways, including inhalation into the nose and the lung, or through the skin or through the GI tract. And this allergen is then absorbed, processed, and displayed in the surface of the APC. Then it migrates to T cell, which then stimulate the B cell to produce antibody specific to the allergen. This specific antibody, or the IgE, and then release attach themselves to the high affinity receptor on the surfaces of mast cell and basophils. Okay, so subsequent exposure to the same allergen will trigger the allergic response, causing the mast cell on the basophil to degranulate and release inflammatory mediators, including histamine, leukotrienes, and prostaglandin. Okay, and then this will cause the allergic symptoms, which can be mild, like itchy, rashes, or severe reaction, such as wheezing, diarrhea, and can cause anaphylactic shock and death. what are the common allergens? Usually, foods including milk, soya, eggs, seafood, peanuts, and wheat. Also dust, mites, pollens, and animal dander. Okay, this is a picture of allergy march. Okay, so it refers to the natural history of the atopic manifestation, which is characterized by a typical sequence of IgE antibody, which may appear early in life, persist over the year or decades. Okay, so the concept of allergic march was developed to describe the progression of atopic disorders from atopic dermatitis in infants to allergic rhinitis and asthma in children. Some may have diseases that persist for several years, where others may see improvement and resolution with increasing age. And the development of these diseases is strongly influenced by both genetic and environmental factors. Now, genetically, uh, children can be classified into low risk, medium risk, and high risk. When the child has no history of allergy with the parents, it's considered as a low risk of allergy. So 10 to 20% risk of allergy. When the child has one parent or one sibling with allergy, the child is considered to have medium risk. The child will have 20 to 40% risk of allergy. When the child have one parent and one siblings with allergy, and the child will have high risk of allergy, it can have 50 to 80% risk of allergy. And also when both parents are allergic, then the child also have a high risk to develop allergy, 60 to 80% risk of allergy. However, as you can see here, even with no his family history of allergy, every child is still have a risk to develop allergy. And what the allergy symptom? It can be difficulty in breathing caused by airway inflammation such as asthma, and also can cause red, itchy, swollen spots on the skin, what we call urticaria. Also can cause red, watery, itchy eyes, dry, itchy, red rashes on the skin, or we call it eczema or atopic dermatitis. Also can cause runny nose with sneezing, which is not due to cold or flu, what we call allergic rhinitis. And allergy affects the quality of life of the children and the family and has no cure. When a child has allergy, may affect the sleep of the child, and when the child cannot sleep, the parents will also have trouble sleeping. Also can cause absence in school because of the symptoms. The rashes may cause social isolation, emotional distress to the child, and also interfere with recreational activities. Now, talking about food allergy, there are two types of food allergy. One is the IgE mediated, which can cause anaphylactic shock, urticaria, even chest pain, chest tightness, and shortness of breath. So swelling of the eyes, wheezing, as you can see in this picture. So the other type is non-IgE mediated food allergy, what we call food protein enterocolitis. Okay, so FPIES, food protein enterocolitis syndrome, is a delayed food allergy that's is a severe condition causing vomiting and diarrhea. Okay, and like other food allergy, FPIES are triggered by ingesting a particular food. Any food can be triggered, but most common trigger are cow's milk and soy. Okay, so what different that set FPIES apart from the typical food allergy is most food allergy occur within minutes, but this food protein induced enterocolitis syndrome usually occur 2 to 4 hours after eating the food that has been recently introduced into the diet. And the primary treatment of this is avoidance. There's no medicine that can help. So must avoid the food, but Luckily, most children outgrow the protein-induced enterocolitis syndrome by age of 3 or 4 years old. Okay. Now, in this graph, we can see that the prevalence of atopic disorders, including the atopic dermatitis, have increased in recent decades. And now, as you can see, is affecting approximately 20% of the population worldwide. So preventive measures are necessary to avoid allergy. In this figure, you can see the prevalence of childhood asthma and allergy in Malaysia. You can see that ever sneeze or runny and blocked nose has 15.2% prevalence, with ever wheeze is 12.5%, and runny nose, blocked nose in the last 12 months, 11.2% prevalence. As I mentioned, in allergy, prevention is the key. So what we have to do is identify the at-risk population. Currently, we do this by determine the family history of allergy, but in the future, maybe we can get the biological markers or asthma and allergy genes, and then we manipulate the environment to reduce the exposure to the environmental pollutants. In the future, we may have dietary supplements, pharmacological agents, or combined approaches. And then the primary prevention, which is referred to inhibiting the development of clinical disease before it occurs. So we can prevent the atopic dermatitis, food allergy, or asthma. Secondary preventions means to prevent symptoms, exacerbation, or lung deterioration in those who have allergy. So it meant to reduce the morbidity. Now we are talking about dietary intervention in children at risk of allergy. Okay, as we know, the breast milk will always be the gold standard. Okay, breastfeeding is critical for the immune development of newborn and infants through immune modulating properties, and it impacts the establishment of healthy gut microbiota. So currently, we recommend to do exclusive breastfeeding for 6 months. Okay, and infants who with documented hereditary risk of allergy, such as have an affected parents and or sibling who cannot be breastfed exclusively, should receive formula with confirmed reduced allergenicity. This is a study from Japan, is studying the breastfeeding and risk of food allergy, retrospective cohort based on 46,616 children. They are classified into 3 groups. One is exclusive breastfeeding, partial breastfeeding, including only colostrum, and then one group is formula feeding only. Okay, so they're looking for association between breastfeeding and risk of food allergy, which can be modified by breastfeeding. Okay, so what they found is in infant with high risk or have infantile eczema, breastfeeding actually decrease the food allergy. So it's a very good prevention. However, in this study found children without infantile eczema actually increase food allergy with breastfeeding. Breast milk is known to reduce the risk of allergy symptoms because it has specific antigenic signature, which explain the low allergenicity of the breast milk. Okay, as Pegan also recommended exclusive breastfeeding for the first 6 months to reduce the incidence of allergic manifestation. Now, you can see from this graph that breast milk protein almost half the infant risk of developing allergy compared to cow's milk protein. In this atopic dermatitis, you can see that the breastfeeding for more than 6 months have lower incidence of atopic dermatitis compared to infant formula children. Okay, also the same with respiratory allergy. Children with breastfeeding more than 6 months have lower incidence than infant fed with cow's milk protein. Now, what about non-breastfed children? Children that not breastfeeding. Okay, for some reason the mother cannot or doesn't want to give breast milk to the child. Now, cow's milk is probably the most complex of all food allergy. It's found that cow's milk protein contain around 1 million times more allergenic beta lactoglobulin than the breast milk. Okay, so it can cause cow's milk protein allergy. The cow's milk protein cause more allergy than the breast milk, because the immune system recognize protein as foreign or not on the base of their epitopes or antigenic determinants. Okay, an epitope is a specific region of an antigen that is capable of initiating an immune response and binding to a specific antibody, leading to allergic reaction. Because infant cow's milk proteins contain many epitopes, so it initiates allergic reaction. So it causes more allergic diseases than breast milk, such as atopic dermatitis. Okay, our Malaysian allergy prevention guidelines recommend to use hydrolyzed formula for infant at increased risk of allergic disease or who cannot exclusively breastfed for the first 4 to 6 months. A hydrolyzed formula appear to offer advantages to reduce the risk of cow's milk protein allergy and allergic disease. So partially hydrolyzed whey formula is recommended, okay, to reduce the risk of atopic dermatitis and cow's milk protein allergy compared to regular cow's milk protein formula. And when considering a hydrolyzed formula, it's advised to choose one with reduced allergenicity that has been proven or confirmed. Okay, so clinically proven hydrolyzed whey formula can reduce the risk of allergy in children. Okay, how does this help? Because in the partial hydrolysis process, the heat treatment destroy the conformational epitopes, and then the specific enzyme hydrolysis also break down the protein into a smaller fragments and destroy the sequential epitopes, resulting in significantly lower allergenic load, and this milk also pre-digested and easier to digest. Now we are talking about the Gini study. This is the German infant nutritional intervention. It studied the long-term effect of hydrolyzed formula on atopic diseases. Okay, so between 1995 and 1998, 2,252 healthy newborn infants with high risk of allergy were recruited at birth in Germany, and then they are randomized to one of the 3 hydrolyzed formula and 1 cow's milk formula. Okay, the 3 hydrolyzed formula are the partially hydrolyzed formula whey, extensively hydrolyzed formula whey, and extensively hydrolyzed formula casein. Okay, they are being fed of this formula for the first 4 months of life if exclusive breastfeeding is not possible. Okay, and they found that both the extensively hydrolyzed formula casein and the partially hydrolyzed formula whey protein can reduce the prevalence of asthma after puberty in high-risk population and retain their effect on eczema until adulthood. Okay, so they can reduce the risk of atopic dermatitis and asthma until around 20 years, because this study followed those infants until they are 20 years old. Okay. The other formula, the extensively hydrolyzed whey, seems it didn't support the idea of preventive effects. Okay, so the early nutritional intervention with certain hydrolyzed formula, if exclusive breastfeeding is not possible, is found to have preventive effect until adulthood for both eczema and allergic airway manifestation. As you can see here, the partially hydrolyzed formula whey protein clinically proven with consistent result in atopic dermatitis risk reduction until adulthood, 20 years old. Okay, this is a study about cost effectiveness of partially hydrolyzed whey protein formula in the primary prevention of atopic dermatitis in high-risk urban infant in Southeast Asia. So using the partially hydrolyzed whey formula versus the standard cow's milk formula in infant at risk of developing atopic dermatitis, they found that there is a cost saving, which is the cost saving is 372 US dollar in Malaysia, 237 US dollar in Philippines, and then in Singapore there is cost saving of 739 US dollar. So it is really cost effective if you use the partially hydrolyzed formula whey protein in infant at risk of developing atopic dermatitis. Now, what about soy formula? Can it prevent the allergy? The Malaysian allergic prevention guidelines does not recommend the soy formula for reduction of risk allergy. Also, Cochrane review doesn't recommend the same. And the American Academy of Pediatrics also say there is no convincing evidence for the use of soy-based infant formula for the purpose of allergy prevention. The same with SPGAN. Okay, so in prevention of allergic disease, soy formula doesn't seem to have a benefit. Now we're looking at another study. This is a diet and food allergy development during infancy. This is a prospective study of 1,140 babies, and the mothers kept food diaries for the first year of life. Now, this study found an interesting thing. Infant diet consisting of high level of fruits, vegetables, and home-prepared food is associated with less food allergy by the age of 2 years. So infant with this kind of diet has less food allergy. So it's a good thing to give fruits, vegetables, and home-prepared foods to your children. Now, this table is a food allergen scale from the highest here on top, like wheat, tomato, strawberry, peanut, soy, egg white, egg yolk, and cow's milk, to the lowest allergenicity here, turnip, rabbit, lamb, rhubarb. Okay, so at the moment, there's no evidence to suggest that delay of introduction of this solid food beyond 6 months old will prevent allergy. Okay, so there's no reason to delay the introduction of this food, although this is the food with high allergenicity, but the delay introduction doesn't cause decrease in allergic diseases. Okay, the delay introduction of solid food, especially the highly allergenic food, may increase the risk of food allergy or eczema. So we should introduce them early. Same as with this peanut allergy prevention in infant. Okay, so for many years, the national guidelines recommend avoiding eating peanuts during pregnancy, lactation, and infancy. However, new research shown that exposing infant to peanuts early on actually may reduce the development of the peanut allergy. So now the updated guidelines is recommending to introduce the age-appropriate peanut-containing food as early as 4 months of age. Of course, infant with severe eczema is recommended to do it in the in-office medical evaluation, and infant with mild to moderate eczema may do it in the at home. But infant without eczema or food allergy freely introduce peanut-containing food alongside solid food. Now, how to counsel parents to introduce highly allergenic food? First, introduce the highly allergenic foods after other complementary food has been introduced and tolerated. Okay, and then introduce initial taste of highly allergenic food at home rather than at daycare or restaurant, and gradually increase the amount of highly allergenic food when there is no reaction. Introduce one new allergenic food every 3 to 5 days, and by the age of 12 months, all the major allergenic foods should have been introduced to the diet. Okay, and in children with moderate or severe atopic dermatitis, despite optimal management, should be referred to consult allergic or clinical immunologist. Okay, for personalized plan to introduce the complementary food. Okay, also the same for children who has immediate allergic reaction to food, a non-food allergy, or has a sibling with a peanut allergy, children with positive food-specific serum IgE to a food not yet introduced, and children who has convincing history of allergic reaction with no detectable food-specific serum IgE. Okay, so in summary, in view of this general increase in food allergy and atopic dermatitis, allergy prevention has become a major public health priority, and it pays to take early action when it comes to allergy prevention via dietary intervention. And dietary intervention is a practical preventive approach for children at risk, and food avoidance does not prevent food allergy, and breastfeeding is the best. Okay, and for those who are unable to be breastfed, clinically proven partially hydrolyzed formula protein should be used. Thank you.
Hopefully everyone can still hear me. All right, we have come to the end of the very interesting talk by Dr. Andy. We have yet to receive any question in the YouTube platform. Dr. Andy, I hope you don't mind me calling you Dr. Andy.
Yeah.
If you can access the YouTube platform from your mobile phone or something, probably you can read the question also if we have any later on.
Yeah.
Before the audience start asking questions, let me start asking a few questions of my own. First of all, it's very interesting to note that formula milk is one of the main cause of allergy in infants. So, would it be correct to assume that at least in infant age, any allergies, skin allergies, we would assume that it is from formula milk?
No,
No,
infant
infant
with
with
allergy,
allergy,
that
it
doesn't
doesn't
mean
mean
that the
that the
allergy
allergy
comes
comes
from
from
the
the
formula
formula
milk,
milk,
but
but
the
the
formula
formula
milk
milk
increase
increase
the
the
risk
risk
of
of
developing
developing
allergy.
allergy.
So
So
in
in
infant
infant
who
who
is
is
at
at
risk
risk
to
to
have
have
allergy,
allergy,
let's say
let's
it's
say
a
their
family
family
or
or
father or
father or
mother or
mother or
sibling with
sibling with
allergy,
allergy,
if they
if they
cannot be
cannot be
breastfed, of
breastfed,
course
of course
breastfeeding is the
breastfeeding is
gold
the gold
standard.
standard.
But
But
if
if
they
they
cannot be
cannot be
breastfed,
breastfed,
It's better to give them partially hydrolyzed whey protein formula to reduce the risk of allergy.
I see. Thank you. So this hydrolyzed milk.
Yes.
Actually, I haven't been asking around myself. I haven't been looking for milk for a very long time now. Is it widely available in the market?
Yes, yes. It's available in the supermarket or pharmacy, I think. You just have to find a milk with a sign on the tin that it is a partially hydrolyzed formula with probiotic or this contain the whey protein.
I see. So it's quite easily available, and you can readily
Yeah, it's
advise your
supposed to be
patient.
able to find in the supermarket.
All right, I see. Okay, we haven't got any question yet at the moment. We will wait for a few minutes. Okay, I got a question from WhatsApp here. It's asking whether this. You just said that the allergies not necessarily comes from the formula milk, but the formula milk might increase the risk of the allergies. And
Yes,
this and these allergies, I would assume it only comes after food are introduced to the infant diet, or is it to other allergens such as environmental as well?
yeah, the as I mentioned in the slide that the allergen can come from many ways. Okay, it can occur in many ways. It can including its inhalation through the nose and the lungs, through the skin and through GI tract. So not necessarily only can happen after food introduction. It can happen from the inhalation of the allergen to the lungs also.
All right. Okay. Thank you. Hope
Yeah.
that's clear the question from this person who actually WhatsApp me. Okay. From the from the YouTube platform, Dr. Hamza Lowry is asking if infant allergy to certain food, should mother who breastfed their children avoid it?
No, as I mentioned also, avoidance of, I mean, if you know the child is allergic to those food, of course you have to avoid those food. But in children who is not allergic yet, the avoidance of this allergenic food is not necessary. Let's say some because of the common allergen is like egg and maybe seafood, then some parents may be afraid to introduce those food to the children. This is not necessary. Even those who are afraid of peanut allergy, is not recommended to avoid the peanut uh, or delay giving peanut to the child. But if you know the child is allergic to peanut already, I mean, you give the child peanut and then they have allergic reaction. Of course, you have to avoid this food. I hope that that is clear that avoiding this highly allergenic food is not recommended because it doesn't help with the development of to reduce the allergy. In fact, introducing early of this highly allergenic food can help reduce the risk of allergy.
Okay, Dr. Andy, I think the question asking whether the mother actually should avoid it instead of the baby.
No, okay. So the study have found that the avoidance of highly allergenic food in lactating also is not recommended.
I see. All right. There are no more questions at the moment. I think we have come to the end of the talk. Very interesting, especially for young mother, young parents. Thank you, Dr. Andy, for that.
Yeah,
information, the
you're
updates.
welcome. Thank you very much.
Um, Thank you for all for participating in this talk. In a short while, we will show the QR code for the purpose of CPD point. Please scan them with the MMA apps. And thank you to our secretariat, Ms. Melissa and Mr. Adrian. Thank you to our sponsor, Borneo Medical Center. And I've just got another question here in the YouTube platform, Dr. Wan. I remember this same topic in 2006 in Kota Kinabalu and was told that in baby of atopic eczema parents should start weaning with seafood bits if the baby is still not developing any rash at time of weaning. Is that still applicable today?
I I think meaning that a baby with parent with eczema, meaning have a family history of allergy, should be introduced of to seafood early. Is it? Is that correct? My understanding of the question.
I'm not quite sure as well, but it said here that should we start weaning the seafood if the
Yeah,
baby still not developing any rest at the time of weaning?
yeah. I think what it means is like that. So if the parent have allergic to seafood and the child hasn't developed any reaction to seafood, I mean, the the baby should be introduced to this seafood early because it found that even with children with high risk of allergy, with parents with history of allergy, introducing the highly allergenic food like seafood is is helping in reducing the risk of allergy. So the child may not have allergy to seafood by weaning them as early as 4 to 6 months.
All right. Okay. I think that answered the question. So it is still applicable today, Dr. Wan.
Yes, yes.
Okay. No more question at the moment. Okay. We will end this talk before we say goodbye. I would like to give this opportunity to Dr. Andy Rahardja again to give final parting words to all of us regarding this milk-related allergy and whatever necessary message that we should get. Thank you.
Yeah, I hope my talk is beneficial and you can understand the principle of preventing allergy in children. So early intervention is necessary and breast milk is the gold standard. But if somehow the baby cannot be breastfed, it's best to use the partially hydrolyzed whey protein formula.
Thank
Thank
you
you.
very much. That's very loud and clear. Thank you, everyone. We'll see you again next year. This next month, December, we won't have any talk. It will be our holiday month, but we will see you again next year in January for a few more talks until middle of next year. Thank you and take care.